So for me, private sector, innovative business model, and collective action at the regional level, putting our resource together, would help actually build the credibility in the long run about doing things based on our own local resource. And I think that's important, that is feasible. It needs obviously political will. It's more about us believing in our capacity and moving that direction. That would happen in every place in the world that we think success has happened. People believing first in them, working together, and finding the model that would work with the local context.
Hello, Dr. Amadou. It's a pleasure to have you join us today on our Curated Conversations series. It's a series that we use to engage thought leaders, policymakers, decision makers like yourself to understand and share what your perspective is on global health. So we're really excited to be speaking to you today because you've had an incredible journey from leading and superstar de Dakar to where you are now at CEPI. You are directing CEPI's global manufacturing and supply chain strategy. How has that journey shaped your view and your understanding on why vaccine equity is so important?
Thank you, Vivianne, and thank you not only for having me, but for giving me an opportunity to talk about some very important topic, which is vaccine equity, particularly in today's challenge we have in global health. To your questions, one thing that was very important for me at IPD, Institut Pasteur de Dakar, was when I realized during COVID, while the world was vaccinated up to 75%, Africa was still around 2%. It was really a wake-up call for us to build the capacity to build some self-sufficiency when it comes to medical countermeasure and particularly for vaccine. So we did a lot of work to do that in diagnostics and vaccines. And while I was doing that work, I was very obsessed with one reflections I had when I visited actually Robben Island, where I've been told by one of the guides his favorite poem that Mandela has, which is the William Henley, that is ending with the fact that it says, I want to be the master of my destiny. I want to be the captain of my soul. And for me, this is one of the reasons why we call our project Madiba. Why? Because being the master of your destiny means really taking your future in your hands. And captain of your soul for me is translating into you have to work with others. You don't need to be bitter. And to bring that to what we're doing with IPD was to say, okay, we need to build capacity to be self-sufficient in vaccine manufacturing, not only for Senegal, because we are 18 million people, not enough to sustain capacities for vaccine manufacturing financially viable, but to do that not only at the regional level, continental level, but do it also with partner in the global north. Now, what we've done over like 5 years at IPD would make much more sense if we build it at the global level, meaning that a global resilient network for manufacturing. And that's one of the reasons why I went to CEPI, to see like if what we do in Africa, we do it in Southern America, we do it in Southeast Asia, and we connect them together in a way that vaccines that are priority for the global south can be manufactured sustainably. That's where actually we can build health security, we can build public health impact, and we can build the economic impact and the equity. And that's for me why what really shaped my vision in terms of saying, build locally something strong, but make sure it makes sense at the global level to be sustainable financially, and in the long run would make sense. So in CEPI, we work mostly on epidemic disease, which are very challenging in terms of from the manufacturing perspective, because you do not have necessarily predictability, and you do not have necessarily the market to sustain it. So you have to be really creative in the way you build it. We're taking small market together, adjust with a good business model, and new technology can build something that is financially viable. And because you're doing it globally, you can be in a position to make it also sort of resilient and ready for pandemic. So that's really what was important and what shaped my vision. Because for me, if you build the equity, you build global health security and you make the world safer. So that's really, really important.
Thank you. I mean, you've really highlighted how, for you, building Africa's place on the global landscape is so critical. I mean, all of us will always reference COVID-19 2020 as that point in which we understood the role that we play as African countries working together. And you worked very closely, for example, with Africa CDC during the COVID-19 response. And that, I'm sure, shaped your view on why partnerships both regionally and globally are also very important. So for you, how much more do you think we need to do, or what have you learned in terms of the importance of some of those global and also those regional partnerships in strengthening our capacity as African countries to really respond to future outbreaks that we will see?
Vivianne, one of the most important lessons I learned from COVID was how strong is Africa when they come united. One of the strengths and the credibility Africa CDC has built under John Kengasson was this capacity to link Nigeria with Senegal leader, with South Africa, to come together to advise our political leadership to take good decisions. So for me, that's really that capacity to work together that can facilitate easily how we reach out to global partners to deliver what we need for our people. And for me, in terms of collaboration, that's the really step that we need to strengthen on and on and on. African Union, WHO, AFRO, West African Health Organization are organizations where our nation should be working together and building the platform that would facilitate. I'm just going to give an example we were referring earlier. Yesterday, we've been discussing about how to bring a Lassa vaccine in West Africa. And while doing so, we get very strong political commitment for many ministers from West Africa, led by Professor Pate from Nigeria, but other minister from Senegal, from Sierra Leone, from other West African country under the leadership of WOW. What we've been trying to do is really the continuation from the lesson that we learned during COVID, meaning that if together we can bring our resource and share our expertise where manufacturing can happen in Dakar, the clinical research in Nigeria and Guinea, the regulatory support to Ghana and Nigeria. And we have, as a group, playing important role in terms of funding. We are setting up a model that would not only help Lassa to come to the market and to the people who need it, but it will also set this exemplar that we need to have a platform on which other vaccine, whether it's Marburg, Ebola, will be made in a region and help strengthen the capacity. So for me, this is the very, very important lesson. Getting united makes us stronger. But the second lesson is when we go as a group and discuss at the global level issues like how do we share samples, issues like how do we work together into raising funds, how do we deal with global health security, it makes the job much easier, but people understanding much better what we're trying to do. Today, in the global health, there is huge change in the priority, security being very important for very good reason. So the reflection in the global north is a lot about how do we bring industry and biodefense together. And that's where also there is a good opportunity because many of the things we are dealing with biodefense has to do with pathogens that are of concern for us. So that's where I'm thinking like offering an opportunity of collaboration as a united group and discussing issue like how do we share pathogen, how do we do research is for me so critical. So that's mostly the main lesson I learned from COVID and how we should collaborate.
Absolutely, because you think about collaboration, and thinking about collaboration, it brings us also to the question of resources, because partnerships can only go so far, and financing, if it's not there, is a big gap. And you've spoken about moving Africa beyond dependency on donors. We saw the recent Africa Health Initiative organized by President Mahama in Ghana, which really talks about African countries being more, dependent on each other and also dependent internally. So really those domestic resources are very critical. So let's talk about how do you think that can be achieved? So moving away from donor dependency, what sustainable, locally funded, but regionally coordinated financing solutions do you think can move Africa away from dependency and make sure that Africa is more self-sufficient to enable response really to pandemic threats in the future?
Yeah, I mean, this is absolutely important questions in the sense that if we haven't fixed the financial piece, it may be very difficult to translate all the good science we are having into reality that impact our population. In this regard, there is 2, 3 examples I just want to touch on to see how we can do it. One first example, at the very beginning of COVID, we end up finding a good technology to make a test, rapid test for $1 that we can. So the business model that we built was very simple to say, we bring partners together, anybody that want to help and support, to actually find a way, like the Netflix model, to contribute to build a structure, and then we will charge only a fraction of the payment to the people that are going to beneficiary. So it's a sort of way how we end up having a test which was highly demanded at $1. So good business model can help to solve the financial thing, because mostly it was local organization, WAHO, Africa CDC, MSF local. This was the one that was, and the government contributed to make that happen. So that was really one first thing. The second thing, which is example what I see, is usually West African organization, they have, the presidents are recently actually contribute to build a fund through WAHO, where the different states will be working together and tapping on that fund to do vaccine development and do R&D. This is a very, very important move. And in this regard also, I think getting the domestic financing and bringing people together is what may help us actually solve the problem locally and not only always depend on donor money. Obviously, we won't be free from donor money tomorrow. We have to be realistic on that. But this is a pathway how we can build in the long run. And the last piece is when we talk about the private sector. In Africa, you see the private sector extremely active. I mean, I've known, particularly in the health sector, very, very good initiative in hospitals, in industry that can be replicated in the context of health. But in this regards, we need our government to also help in bringing enough incentive for people to naturally invest in vaccine manufacturing, because you need passion money and you need also to be able to do that in the long run. So for me, private sector, innovative business model, and collective action at the regional level, putting our resource together, would help actually build the credibility in the long run about doing things based on our own local resource. And I think that's important, that is feasible. It needs obviously political will, but it's really, really important to move forward. And there are examples, as I was telling you, oh, this is feasible. It's more about us believing in our capacity and moving that direction. That would happen in every place in the world that we think success has happened. People believing first in them, working together, and finding the model that would work with the local context.
Okay, thank you, because yes, you're very right. Financing is very important, be it from the private sector, government, as we saw yesterday with Ministerial Roundtable, getting the commitment from African health ministers, but what it enables is equally as important. And CEPI focuses on manufacturing supply chain, and that puts you in a really important position and able to make decisions that drive real change. And right now is a really exciting moment because there's so much innovation taking place. So in your new role at CEPI as Executive Director of Manufacturing and Supply Chain, you're responsible for enhancing manufacturing capacity. What do you see as some of the more exciting, promising technological breakthroughs, or even regional models that can accelerate vaccine accessibility?
Mm-hmm. Yeah, one important concept, which is more like a North Star in CEPI, is 100-day missions. And this comes from the idea we want to develop a vaccine that may be at least in terms of authorization, emergency use authorization, be able to be available in 100 days, 3 months. And this comes from the reflection that if we had the vaccine in 3 months in COVID, it would have changed significantly things. So because of that, we have to build tools that would make us ready. And in this regard, there is one tool that I think is real important, is the platform. Platform mean that whether you're talking about a technology like RNA messengers, or a technology like viral vectors, or a technology like protein, to be able to have this tool that you can use, which is pathogen agnostic. Whether you talk on one pathogen or the others, you can use that platform and that same modality to be able actually to make a vaccine quickly. That idea of platform, in a way that CEPI is developing with his partner, for me is a real important breakthrough that Africa should jump in and regionally should jump in. The second important technology we are actually all aware is AI, artificial intelligence. Today, designing an antigen and making sure it is going actually to be able to be ready and immunogenic is very important, and miracles are done just by using digital knowledge and data. The reason why I look at artificial intelligence and this technology like a platform, if you combine them, you get a very, very powerful tool where you can get vaccine maybe in the coming years developed in 3 months. And this sort of technology did not exist before, and put Africa in a position of being really in an opportunity to leapfrog. Meaning that we build our future not as the past of the others, but completely different, because the future of Africa should not be the past of other people. The way vaccine was done is completely different. So if you look at this way, you may have technology like robotics. You combine that with platform, with artificial intelligence. You may have vaccine manufacturing as lower costs, lower footprint, lower capex. And this is a change that Africa can jump in and have an industry that would be way better than what exists today in the most advanced countries. And if you look at that way to develop vaccines, it's a lot about creativity, artificial intelligence and data. And we know how Africans are creative. So if it's about using digital information, gathering data, and being creative under very strong rule, that's something that may be important. Tool, I think, when we talk about innovation, we think a lot about technology, as you mentioned, but regulatory, which is the way that people are making sure through some very strong regulation how vaccines is coming safe and stable and of quality to people, is an opportunity where there is a lot of innovation that happened. That's how we could develop a vaccine in 1 year. In Africa now, we have a continental agency, which is called AMA, African Medicine Agency. And we have also opportunity to learn a lot from this way to do, and that will change everything. Now, on CEPI, there is one more thing that we do, is what we're thinking at the level of Africa is very important in Southeast Asia, in Western Pacific, and Latin America. So we are building what we call these viral manufacturing network facility. And that would interconnect different manufacturers that we find typically in Africa so far. We work in IPD in Senegal, we work with Aspen in South Africa, we work in Rwanda with the partnership of BioNTech. And we also work in Southern America with Brazil, and we work in Southeast Asia with Biopharma and Serum Institute of India. So when you bring all this network, you create an opportunity where any innovation can be standardized, replicate, and work among those groups. So when we have an epidemic, when you have a pandemic, those resources can be used. So having this network, be able actually using this platform and this new technology to have a great portfolio that you can take to those manufacturers would not only help to get the vaccine quicker in pandemic, but it would also help us focus on some priority pathogens that are really important for Africa. typically Lassa, Rift Valley fever, Ebola. These are priority pathogens at CEPI. And that's why it is so exciting, because these are our priority in Africa. And that's why it is so important combining this technology with this priority pathogen and having the platform that are very agnostic make the strategy and our reflection so exciting. The last piece of the strategy would be actually to help the ecosystem, because once CEPI has fund development, which is the research and development, we need to bring those products into the finish line with manufacturer. And that's where actually having the rest of the ecosystem through regional vaccine manufacturing capacities, collaboration, through DFIs, development finance institution, through Gavi, through WHO, together to support the manufacturer to take those portfolio and manufacture sustainably. That's what the strategy is about. So in a nutshell, those technology need to support the impact. CEPI can create the knowledge and take this knowledge into impact in a way that it collaborates well with developers and manufacturers. And Africa is top of the priority. That's why all this innovation we're talking about are today being deployed in Senegal, in Nigeria, in South Africa, is all these partners in Africa, because we believe that's the future.
Okay, very, very true. And you've definitely highlighted how exciting we are, the space we are in right now, with the amount of innovation that's going on. And AI, you mentioned we've heard about it through the conference so far, and how it could be a means to accelerate the development of vaccines. But underpinning it also is actually building the science capacity in our respective African countries. I think that's one area where a lot more needs to be done. And that's a whole ecosystem approach from the educational sector, now working with universities to build that knowledge. But also really hearing the work that CEPI is doing in really bringing together the developers and supporting with the funding streams, I think is critical, and something, we have the opportunity to learn and grow and leverage as we go forwards to accelerate the eventual licensure of Lassa vaccine and all the other priority pathogens where we don't have the requisite countermeasures to address them. Thank you for that, Amadou. I'd like to just, bring it back as we wrap up to the bigger picture, to your new role at CEPI. We're at a time where, yes, we're pushing for self-sufficiency in Africa. So for you, it's an opportunity to leave a lasting legacy. I know legacy is a bit early to talk about. You've just started. But I'd like to hear your reflections really on that. From, you worked at IPD before, you had a really great and long, illustrious career there. And now with this new career, or this new role at CEPI, it's a time when Africa is really pushing hard for self-sufficiency. It's an opportunity to hear what impact do you think your work will have in advancing Africa's vaccine production and also autonomy and strengthening local capacity and leadership?
My main ambition and really driver is really equity. So if we can build, through the work I'm doing together with our team and the other people, regional manufacturing into a way that diagnostic, vaccine, and drugs can be done in Africa in a record time, meaning that this idea of 100-day mission, I would be extremely satisfied, because I think this would bring impact. But I want to say also, it's really important when we do that in Africa, and to make it really viable, it needs to have an arm which is in the global south. For me, it's as important to develop the things in Africa than making sure it happens in Latin America and Southeast Asia. What this gives us is not only we can learn from each other, but it gives us the market, the culture, and help us to be sustainably viable. 50 years ago, India didn't have strong vaccine manufacturing. Today, people should know that India is the largest manufacturer of vaccines and somehow drugs. And this is not something that is not possible for Africa. It is really reachable. And for me, the only way they can do it, because India has made a lot of product that has been sold in Africa elsewhere. So my dream is to get African to develop product that will be sold in the rest of the world after serving the African purpose. So for me, that's where we will have equity, we'll have business that would lead to sustainability, and we would have the cooperation. Because at the end of the day, for me, what is the most important thing about leadership is about human being. If as a global human being and as a humanity, we work together on solving our problem and understanding that equity is going to make us, it's not only a moral obligation, it's just the solution for all of us to be in security and have a common future. That's what I would think would be really impactful. So that's really my dream. I don't know whether we're going to get there, but at least I'm passionate, motivated to work with everybody from Senegal to London to CEPI to somewhere else. That's actually why I'm so passionate what I do, and that's why I'm happy to talk about it.
Thank you so much, Amadou, for those really great insights, and really exciting to see your new role at CEPI. I think moving from regional to really global is so critical, having you share that expertise and also having your lens very much focused still on the African continent. As we know, expertise and learning from people like yourself is critical. And we look forward to seeing how that legacy you hope for unfolds in the coming years. So thank you so much for your time. It's been a real pleasure talking to you as always. Thank you so much, Amadou.
Thank you, Vivianne.
Thank you very much.
Great pleasure. Thank you for having me.
Thank you.